Hi everyone, these are the important questions. Do I need to go for chemotherapy? How many sessions of chemotherapy do I need? What about immunotherapy? What about surgery? What about CT scans? Well, join us on our Simply Healed program every Thursday nights at 7:30 p.m. Singapore, Hong Kong, and Philippine time. Our sessions are interactive, featuring a live Q&A with experts and doctors who will answer your questions in real time. You can type in your questions and get immediate, personalized responses. This is your chance to take control of your health. So take advantage of this informative and supportive experience. Visit our Facebook page and message us on Messenger to find out more. See you there this Thursday.
One reason why I recommended initially PPARS is because it can induce lung cancer cell death. The main reason why I tried PPARS liquid, and it did well for the patient. It helped with the tumors. The enlarged abdominopelvic lymph nodes were not detected. This was gone. So that was something that I was actually quite surprised. A 12-centimeter tumor disappearing.
Everybody turn to your neighbor and say, do more. Right? Don't just think there is no one product that will cure you of cancer. Okay, that is like it's like a scammer trying to sell you something. All right, it is a comprehensive approach. When you need surgery, do the surgery, but prepare for the surgery so that you recover well, right? And then if you need to do chemotherapy, radiation therapy, do it. So this is where PPARS really comes in. It's a gene activator, so it's a signaling pathway. It switches on your pathways, your systems. Then the other nourishment that you take will be properly used. Is it easy to understand now?
Now let's not keep you waiting. We are now officially opening the AMA or Ask Me Anything portion.
So she has to take maybe just the capsule or the powder just to regulate blood sugar. And then undergo the surgery, and after the surgery, to aid in wound healing also and for recovery, she can continue the capsule.
I can safely say this, all LJ products are great. But if you have acute illnesses like cancer, then we are a world of a difference. Because if you want chlorella, take chlorella. Diba? If you want spirulina, take spirulina. When you take Simply Nature PPARS, you're taking our microalgae for its PPAR agonist.
We are always with you from start to healing!
Yung sister ko had the symptoms of diabetes. Siguro 10 years na. Madalas siyang umiihi, tapos laging pagod, pumayat, mataas ang BP. Tapos siyempre, mga non-healing wound.
Yung sa paa po ni ma'am, paano po yun nag-start?
Okay. Kasi ganito yun eh. Yung first na hospital niya, not because of diabetes. Ang una niya, pneumonia. Ayan. Doon nalaman na may diabetes din siya, by accident. Right foot niya, may para siyang matang isda lang. Yung maliit na itim lang. Tapos napapaligiran lang siya ng parang dilaw na kulay na dilaw. Ring sa sugat na yun sa center. Tapos tinanong ko, bakit? Hindi niya daw alam anong reason. So sigurado ko dahil nga may background ako sa medical, siguro dahil yun ay lumala na yung taas ng sugar niya, hindi niya na monitor, hindi niya nabibigyan ng gamot, nagkaroon siguro siya ng komplikasyon. Yung nerve sa paa na damage na, So, hindi niya na nararamdaman na may natapakan pala siya. So, probably, yun siguro yung nangyari. May natapakan siya, nasugat yung paa niya, maliit lang, tapos hindi niya naramdaman. Lumala. So, nagkaroon siya ng lagnat on and off, nakahiga lang siya. So, sabi ko sa kanya, so, anong plano mo? Sabi ko, pa-check na natin yan. So, pina-check namin as OPD. Chinek, binigyan, niresetahan ng gamot, tapos tinignan yung sugat, binusbos. Pero kapiranggot lang ang tinignan. Tapos, in-advise na lang kami, linis, at 7 days na gamutan ng antibiotic. After na 7 days, lumala lalo. Yung pinaka-pamamaga niya, lumaki lalo. So, sabi ko, ay, na-infect na to. Nilala ko sa emergency room. Ayun, doon nalaman lahat. Mababa pala hemoglobin, mataas masyado yung sugar, yung diabetes niya, talagang marami ng komplikasyon.
Ano po yung plans ng doktor niya?
Na-refer siya sa ortho. Ang plano sa kanya ay putulin. VKA or the below the knee amputation. Hesitant din kami pumirma ng consent. Then later on, ni-refer naman siya sa plastic surgeon. Nagsabi naman sa amin na maganda pa circulation. Might as well na tulungan na lang natin yung paa, linisin, wound dressing for twice a day, then debridement as needed, religiously. So, yun ginawa namin. Twice a day kami naglilinis, tulungan kami ng husband niya. Hanggang ang nangyari, gumanda, pero andun pa rin yung plan na putulin. Hanggang makita na gumaganda na, ayun, hindi na naulit yung plan nila na maputol yung paa.
Kasabay po ba nun may mga tinitake pa siyang gamot?
Bukod doon sa antibiotics, bukod sa mga gamot na binigay ng doktor sa ospital, may tinake din siya na alternative medicine, yung PPARS. May kamahalan. So, sinugal ko para, kasi kailangan kung hindi mo isusugal yun, baka maputulan talaga. Kasi kahit naglilinis kami ng paa, tapos nagdidibri, pero parang slow yung healing process niya. So, I tried na painumin siya at 10 tablets at AM and 10 at lunch and then 10 at the evening. And the soft gel, twice a day also. So, religiously binibigay ko yun sa kanya. Ang dati kasi dahil nag-peak yung WBC niya, medyo nag-septic siya. Sa mga nakakaalam, sabihin yung infection kumalat na sa buong katawan. Kaya nagkaroon ng problema yung kaisipan na nawala sa wisyo. Dramatically, yun yung maganda doon. Dramatically, after 1 to 2 days, parang nakita ko siya ng improvement. Doon, nakita namin na sa help ng antibiotic and together with PPARS, sabi ko, maganda yung kinalabasan. So, why not continue? Hanggang nakita ko rin na gumaganda yung healing process. Tapos yung WBC, nag-dramatically from 46. Imagine, 46, dramatically bumaba siya ng 39, 33, 27, 19, 15, and then 11, 9, 7. So, nakikita mo talaga yung changes na nagawa ng gamot na yun. So, yung support ng family ay mahalaga sa recover ng pasyente. So, una, yun yung talaga nakikita ko, yung support system. Then secondly, syempre, with the help of the advanced technology, like yung mga ini-introduce ng mga gamot, hindi ko pwedeng alisin yun sa scene, sa scenario. So, ako kasi, dahil nga nasa medical field ako, medyo alam ko yung mga ganyang mga alternative medicine and evidence-based ako. So, sa PPARS, sabi ko nga, maganda yung result. Ito walang harong biro to. It's not joke. Yung mo ako binayaran So, it's no joke. Talagang maganda yung yung nangyari sa kapatid ko, lalo na yung wound healing. Yun yung nakikita ko, yung wound healing talaga. Nag-granulate siya, gumanda yung circulation, nabuo ng laman, okay? Nagkalaman yung mga paa niya na dating wala. Makikita niyo naman sa picture, di ba? dating wala, nagkaroon ng laman. So, na-prevent natin yung pagputol. I can say na effective. Okay, effective yung PPARS.
Ano yung ma-advise nyo sa mga patients na same case sa sister ninyo?
Okay. So, advise them to try. Then, kagaya ko, gusto ko may ebidensya na experience ng on hand ng ate ko. So, ganun din yung papayo ko. Try to experience yung healing, try to take the medicine religiously ha. Despite medyo may konting kamahalan, but then kung titignan mo naman yung long term na gamutan, mas mahal yun. Tsaka hospitalization. At yung syempre, yung recovery. Yun yung maganda doon eh. Yung recovery, mapabilis. So, try ninyo. Hello, I'm 𝘗𝘗𝘈𝘈 my sister, diabetic since way back 10 years up to now. Because of Simply Nature, hindi niya na kailangan mag-amputate. Yung recovery niya, yung unti-unti nagkaroon ng maganda, nagkalaman yung kanyang mga paa. Still recovering, yet nakikita ko yung magandang bunga. And that is because of Simply Nature, PPARS. And I trust Simply Nature.
Assalamualaikum warahmatullahi wabarakatuh. Bismillah. Siya 𝘗𝘗𝘈𝘹𝘱𝘰𝘮, taga Zamboanga City. Pero dito na ako nakatira sa Maynila. 13 pieces na bukol, pero yung mga iba maliit siya. Pero yung itong isa malaki siya, parang umabot na ata ng 3. Kaya nga ito sabi ng doktor, kailangan tanggalin na. May kaibigan ako, i-try ko daw itong yung PPARS. Pangalawang gabi, may naramdaman ako parang iba. Yung parang may langgam na parang gumagalaw ganyan hanggang dito, hanggang sa talambakan, ganon. Pangatlong araw ko. Parang kung sumakit yung dito ko, parang gusto ko talaga. Pag ko ganyan sa CR, yun parang lumabas talaga na ganyan, napakarami talaga. Siguro sunod-sunod yun, 3 araw, ganon. Tapos sabi ko, pagtapos yung dito ko, minsan yung parang, ganon-ganon ako. Parang masikip dito, parang minsan sumasakit dito ko, ganyan. Yung na ako dito, umabot na ng mga 5 days, ganyan. Parang nawala yung sakit dito, nawala siya. Parang hindi na ako ganon-ganon. Pag nagsalita ako, parang tuloy-tuloy na, wala na akong halos maramdaman. Kaya siguro, hindi ako, sabi ko, parang ayaw ko magpa-opera. Siguro, mayroon talagang gamot para dito. Binigay ng God. Ngayon, hanggang ngayon, parang maganda ang, maganda ang pakiramdam ko. Yung high blood ko, pag parang magandang tinanggal ko na yung sa cholesterol ko, hindi na ako, pero yung sa cholesterol ko, pag tinatanggal ko yon, parang hindi, mga 2 araw, parang masama ang pakiramdam ko. Pero ito, 14 days na, ngayon 14 days na, basta 2 weeks na, hindi ako uminom ng subastatin, wala akong nararamdaman na parang maganda ang Kaya yun, ngayon bumili pa ako ulit ng tablet. Oo. Kasi sabi ko para para lumakas talaga sa akin Kasi nararamdaman ko talaga na maganda. I ignore my Yusuf. Ay bukol ako dito sa liig ko. 13 piraso. Umabot na ng 3 cm. Take ako ng PPARS 2 times, morning at saka gabi. Pag numulok ako, hindi ko na siya mararamdaman. At saka kinakapa ko siya, parang nawawala, parang wala na, hindi ko mahawakan. Hindi katulad ng dati. Salamat, Simply Nature.
And we are live! Health Today, everyone! My name is 𝘗𝘕 𝙤𝙤𝙀𝙀, a licensed pharmacist and one of your trusted health advisors here in Simply Nature. We are an international distributor of powerful food supplements made from a unique strain of microalgae called PPARS, which has been tried, tested, and certified to support not only cancer treatment, but also general health and metabolic syndromes like hypertension, diabetes, and high cholesterol. And last week, Thursday, just a quick recap, we learned a structured step-by-step, paper-informed approach to calm chronic inflammation and support immune balance. But moving forward tonight, let's discuss the first steps to take right after a diagnosis to reduce the risk of spread, the timelines, tests, and coordinated care that keep you on the front foot. We will get a clear, actionable game plan you can discuss with your doctor immediately. But first, what is metastasis? So think of cancer cells as seeds. Metastasis happens when some seeds break off, travel, and try to grow in other soils like bone, liver, or lungs. So whether they take root depends on, number one, the seed, meaning the traits of the cancer cell. Then number two, the soil, which is your body's environment, meaning the hormones, inflammation, and immune balance. And third, the time or opportunity. So the delays in your diagnosis or treatment can give the seeds a head start. Now, our job is to treat the seed with evidence-based medicine and improve the soil with supportive strategies so seeds struggle to grow. Research and clinical practice agree. Early and decisive steps, especially in the first month, improve control and coordination of care. So, let's get oriented fast. Within the first week, we should, number one, confirm staging and plan, ensure pathology is final, ask about any missing imaging needed for staging. So we know exactly what we're treating, be it like PET-CT, MRI, or bone scan, of course, indicated by your cancer type. Two is a multidisciplinary input. So do you need to request a tumor board or a second opinion? If unclear, then the time targets, clarify when treatment starts and why that timing is appropriate. Of course, you can skip your baseline labs and vitals. So your team can monitor trends through CBC, CMP, and other, etc. doctor advices. And lastly, pharmacy safety check. List all medicines, vitamins, and herbals and coordinate with your pharmacist. Okay, so week 2 to 4 is to strengthen the soil with, of course, nutrition you can keep down. Protein at each meal with gentle fats and fruits and veggies. Next, I can't say this enough. Hydrate, hydrate, hydrate. Also, movement snacks. So 5 to 10 minute walks 2 to 3 times a day is already great for circulation and mood. Partner with sleep routine. Consistent, dark, cool room supports repair. But the keyword here is consistent routine, ha? And lastly, infection vigilance. So fever or rapid worsening or swelling, chest pain, sudden shortness of breath. Yeah, and so you should already call your team. But, beyond medicines, many patients ask how to support the soil, energy use, the inflammation balance, and tissue recovery without disrupting treatment. So let's turn your fear into focus. Trust the experts. Tonight, we'll hear from Mr.Shyan Lim, who will share how PPAR-active microalgae-based nutrition is used by many as adjunctive support. So still coordinated with medical care. He is a seasoned international speaker on a wide range of topics from personal success to healthcare, who is also the founding director of Simply Nature International. You all know him. Our PPARS expert from Singapore is Mr.Shyan Lim. And then we keep this discussion evidence-aware and safety first, always aligned with your oncologist. That's why we're bringing in Dr. Jansen Calalan for the clinical lens. He is a graduate of St. Luke's College of Medicine, a diplomate of the International Board of Lifestyle Medicine and the Philippine College of Lifestyle Medicine, currently serving as a consultant at renowned institutions including Alta Integrative Medicine and Wellness Complex of Perpetual Health Medical Center Las Piñas, Tree of Life Wellness Center, Centro Holistico, and Simply Healed Medical Group, where he practices integrative oncology. Good evening, gentlemen.
Good evening.
Hello.
Good evening, Jen. Good evening, Doc.
Hello.
It's our last
Hello, good
webinar
evening.
for the month.
Yeah.
So,
Yeah, let's
Let's
start.
get started.
It's a long
Time
day.
flies.
I just came back.
Okay.
Yeah.
Okay, first question coming from Drea. How would I know if the pain I am experiencing is not a metastasis?
Wow. Oh, I guess first of all,
You need the
metastasis.
scan. It has to be correlated with the scan.
But she said pain. So, oh, okay, yeah. So a pain in a different area, she might assume is a metastasis, yeah. So,
Yeah.
okay.
So for any
Yeah.
for any cancer, for any cancer patient, if you feel pain, the first thing that you have to think of is it can be pain from metastasis. So that's the first
Possible.
suspicion that you have to rule out.
Okay.
Otherwise, it might be musculoskeletal only. So these things has to be correlated with an imaging result. Yeah.
Hallelujah.
Next question coming from Abby. When to know if I really need to go for biopsy or if I can still buy time to try alternatives? When to know?
Depends on. It has to be an agreement between you and your doctor. So each doctor would have different threshold or different thresholds. So I for one, we can attempt to go in and try different treatments first and see. So but it also depends on the type of cancer that's being suspicion. The suspicion of what kind of cancer it is. So for example, thyroid cancer, since thyroid cancer is more of an indolent type of cancer most of the time, then you can afford to wait and see. For the other more aggressive types, you cannot wait. You have to immediately know what you are facing. Now, biopsy, okay, a lot of people are afraid of it. But guys, for you to win against an enemy, you have to know who you are fighting. If you don't know who you are fighting, how are you gonna win? Yeah. So the way to do it, are you gonna use a nuclear bomb to kill the enemy? Or what? Would you want a sniper rifle, a sniper to shoot, to attack with a more precise way? So, of course, you would realize that a sniper would have different collateral damage versus a nuclear weapon. So that's the So think about it. Think about it. Okay. So biopsy is important because that's one way for us to know what kind of enemy we're fighting and what kind of weapon to use against the enemy. If without the biopsy, you're going in blind. Okay, so that's the thing. That's the thing. But I understand though, the biopsy tends to have side effects, or quite afraid that the cancer might spread. But the reason why you're doing it in the first place is to get treated immediately. You don't do biopsy and wait for 6 months, 1 year before getting treatment. Okay, it doesn't make sense. It doesn't make sense to do it like that. All right, because when you do the biopsy, especially core needle, there's a risk. The metastasis chance, the risk for metastasis, long-term metastasis increases over time, especially if you go beyond the 2-month mark.
Amen. True.
Okay, so when you do the biopsy, get treated immediately. Which is it in the first place.
So the number one, the key and most important advice Dr. Jansen just gave is this. If you are a cancer patient and you have pains elsewhere in your body, never ignore it, right? It could be metastasis, so always have it checked. If you're not sure, for example, you live in a place where going to the clinic might not be so easy, then, do a teleconsult, right? Do a teleconsult with a doctor so that you just share your symptoms and the doctor will be able to advise you. So basically, as a cancer patient, you don't want to miss your cancer staging going up. That means if your cancer did metastasize, it's immediately time to look at the protocol that you're using, maybe adjust the dosages, and maybe even look for additional things that you may need to do. So for cancer, don't guess. You should always find out exactly what's happening.
So for those of you who wish to have a consult with Doc Jansen Calalan, you can schedule an appointment using the link in the description box and comment section below. Then our caring healthcare specialists, Miss Beth and Miss Irish, will reach out to you shortly. Next question is thrown to us privately from Miss Sanya. Can PPARS help with bradycardia? But first, what is bradycardia, Doc?
That's a very general question. Bradycardia is literally slowing of the heart rate. That's it.
Yep.
That's it. Yeah, what causes slowing of the heart rate? We don't know. There are a lot of factors. So how can PPARS help bradycardia? I don't know. Depends on why you have bradycardia in the first place.
Yeah.
Yeah, so yeah. But I don't know. I don't know how.
I'm biased. I'll just say you should be taking PPAR tablets anyway. It's good for your cholesterol, good for your metabolic syndromes. But you know, for this case, I think you need more diagnosis. Then you probably need to go to speak to a doctor, have a consult, so the doctor can ask you more questions and decide what next to do. Okay, yeah. But of course, take PPAR tablets. It's just good for your health. All right. So I'm not saying to take it for your current, specifically for your current condition. I'm just saying if you're not taking any supplements, then it's a great natural plant-based whole food to take as a start.
Okay. Next question from Ramil is PPARS. I know this is high, but my naturopathy doctor said to observe first. My uncle said to observe first also. So how long should I wait? What can you recommend?
First of all, PPARS is not high. PPARS 3 is so when you Google PPARS category 3, no, it will say it's a probably benign finding. Probably benign. So yeah, so it means more of a benign diagnosis, PPARS 3. So you observe how the tumor evolves over time. Because sometimes benign tumors rarely become cancer anyway. Okay, so if it's truly benign, then yeah, don't have to do anything with it. But of course, you have to observe, because what if that benign tumor a cancer? Okay, that seemingly benign, looks like benign characteristics with benign, that is benign. Yun pala, it has cells already. So you have to wait and see how it evolves. All right, now, can you do something else? Can you do more for this? Of course.
Surgery is an option, right? Yeah.
Yeah, surgery can be an option, especially if the tumor is really, really big. So you can opt for an elective lumpectomy, especially if it is causing pain. No? So surgeons do that. Now, say for example, you're apprehensive of going for surgery. What other tests can you do to check, no, if this might be cancer? Then you can do liquid biopsy. So liquid biopsy is a test wherein you get blood sample and test for circulating tumor cells. Beyond that, you can also go for a test to check if your white blood cells are expressing genes to fight cancer. Yeah, so this is a screening test, and if it turns out positive, then the suspicion for a cancer diagnosis increases. Then you have to chase it. So that tumor would have to be investigated further. So one thing that you can do probably would be MRI, breast mammography, if you haven't done a mammography yet, because breast ultrasound alone is not enough. It's not enough to, it's not enough. So a PPARS 3 category tumor, on ultrasound alone, it has to be correlated with a mammogram. Now, if the mammogram tells you that the mass has malignant characteristics, or it shows a higher PPARS category, then you follow the higher PPARS category. Okay? So, yeah, so those are the things that you can, the tests that you can do. Now, say for example, going back to the screening test, no, the oncodeclare test, so the checking the white blood cells, no, if they're expressing genes to fight cancer. If it is positive, then you can check circulating tumor cells. So if the circulating tumor cells for breast cancer is positive, then you have to be treated as someone with active breast cancer already. Then the biopsy mass would have to be biopsied. Okay? Okay? But right then and there, with the information that you get, no, the circulating tumor cells with the liquid biopsy, you can already start natural extracts to suppress the stemness characteristics of the cancer, or basically to suppress the cancer. Okay, then you do the necessary conventional path. So you biopsy, check immunohistochemical staining, check staging through imaging, if it warrants surgery, etc. Then you go for those things. Okay, yeah.
Okay.
Yes.
So, moving on to Leah, can benign thyroid cysts can lead to cancer if not treated?
No, cysts don't become cancer. Because cysts are fluid. It's just fluid inside. With some exceptions. For ovarian cysts, suspicion for cancer should be higher. But again, cysts are benign because it's just fluid inside. Okay, so it's like a bubble. But it's water inside. Okay, so those are cysts.
So what's the usual course of treatment for cysts, though?
For that, you observe. If it is increasing in size, you cut it out. You can also aspirate those cysts, no? Big cysts. You can aspirate that. So for example, huge breast cyst. You can aspirate that. It can be done clinically. So just inject, use a syringe, empty syringe, inject that, but must be guided with ultrasound, of course, no? Inject that, then aspirate. Then it's up to you if you want to send it to the laboratory to check if there are cancer cells, or just leave it alone. So yeah, it's up to you. So those are some of the treatments that you can do. If you don't want anything invasive, you can try Simply Nature PPARS to see if the cysts respond. So I have my fair share of patients, especially patients who have thyroid nodules and cysts, no? I've given them Simply Nature PPARS. They usually respond, no? 70% of them, actually no, 70 to 80% of them respond.
Wow, that's a very good. Thank you for sharing that. Yeah,
number.
I didn't know also. That's a very high number, because sometimes benign cysts and growths, we have no reason. Sometimes we don't know why they happen. Because especially with patients who seemingly have relatively healthy lives, it's a puzzle. So with viewers who, and you should be, right? All viewers should be. With viewers who have found like growths and cysts in your body and you feel uncomfortable not doing anything, I think you are right? If I have a growth in my body, I want to do something about it. Surgery is a very real and quick option, and especially if it's big. If it's benign, it's a good news. That means you're not under time pressure, right? When you're not under time pressure, you don't have to go for the expensive things. That you can do things that work well. It may take a longer time, but anyway, walang cancer is just benign. So I think PPAR tablets is very affordable, good for your health, for your metabolic syndromes and everything, and give it time to see results. And as Dr. Jansen very encouragingly shared, it has a good incidence of success with his patients, and same with our other clients as well.
Okay, moving on to Realine. Can PPARS help with influenza? Very timely. What's the best recommendation for children and adults?
Influenza, you don't do anything with influenza. It goes away on its own. The only
no, I want to ask, why do people say, if you're coming down with a flu, take lots and lots of vitamin C? So is that like a myth, or
Because it shortens the period that you're sick, but it shortens by 1, 2 days.
So what is the mechanism so that we understand, right?
Yeah.
What happens when you get influenza? It's a virus, right? So what is how does the body treat a virus? Yeah.
Okay, so your vitamin C has direct antiviral effects. It also indirectly attacks the virus by stimulating the immune system, the white blood cells. Okay, so the mechanism of action there is vitamin C enhances the oxidative burst of the white blood cells. That's why with vitamin C supplementation, your immune system is more aggressive, it's more active. That's why the period that you are sick shortens. So that's two concepts already. Number three concept: if you're sick with any viral infection, inflammation is gonna be high. So inflammation, why is inflammation high? It's because your immune system is attacking the virus. Now, the problem there is you can be very, very sick because of very high inflammation, and you might have trouble suppressing the inflammation. So in other words, there's too much fire. So you have to put out, you have to tone down the fire. Okay. So vitamin C does that because vitamin C is a very powerful antioxidant. So it can also help the body combat excessive inflammation to tone it down. So you feel a little bit more comfortable. You can still function even if you're sick. So I'll give you an idea, what the picture would look like. So influenza, usually symptoms are what? Colds, cough, fever, body pains, headaches, dizziness, can be diarrhea, nausea, tummy ache. So these are some. Now, if you are relatively healthy, you are well supplemented, you do your part well, no? You can probably have a few symptoms like cough, colds, probably sore throat, but you won't have any fever, body pains, headaches. You won't even have diarrhea at all. So you can have a few of those symptoms only. You can actually even have, just colds without the sore throat, without the coughing. Or you can just have a little bit of throat itching, but without the runny nose. Some patients can have diarrhea without the rest of the thing. Okay, sometimes there's no fever at all. Okay, so this is the difference. So if you're someone who's not healthy, you get the picture. Then you might run with fever and all of these, 70-80% of the symptoms that I mentioned. So then you'd be really, really sick at this point. Yeah. Okay, so that's the difference.
Wow.
Okay, so that's how supplementation vitamin C can help.
Well, Doc, I did a little quick search on, I just did a quick search on how PPARS can actually help with influenza. It's very interesting. It says viruses depend on newly made fats to build their envelopes. Wow, this is very technical. It says PPAR alpha activation ramps up fat burning and turns down fat making programs. So you end up with less viral building blocks. It makes gamma improves cholesterol handling, which reduce lipid raft density. Wow. And then a lot of viruses use these rafts to enter the thing. Wow. I mean, wow. Does this bring back memories from med school?
Yeah, a lot. Yeah. So those terms are we studied in med school.
Yeah, so it's very interesting, guys. Yeah. So basically, you can, I guess, eating healthily when you are suffering through viruses do help. I think these reasons that it lists for PPAR is also some of the reasons why when you're having flu, please don't eat fried chicken. You know what I mean? It doesn't help, right? So I think, just for everybody's interested. And I'm just saying, wow, nowadays the AI is incredibly useful. But you know what? Doc, I still don't trust the AI. Because I don't know, for our viewers out there, I don't know whether you know or not. AI can create facts and believe themselves. So sometimes AIs actually create their own facts and they believe it, and then we believe the AI. So it's very important. That's why even with the advance of AI, a program like what we have over here is still very important, because Dr. Jansen is a well-trained, very highly regarded doctor. So he's actually very important, because at this point, we still cannot believe our AIs. We can use them to give us clues, but we should always verify the information. And nowadays, it's not easy to verify information, because every website cross-reference other websites. So if one website is lying, all the websites are being lied to at the same time. So, you still need to believe your doctors. But so you can, so again, that's why we love Dr. Jansen. Hallelujah. That's why we trust Dr. Jansen. We need Dr. Jansen. Amen.
Okay.
Thank you for that.
Yeah, it's true, Doc, because I think some patients think that all they need to do is ask AI. And I mean, I also ask AI. I think Dr. Jansen also asks AI, right? Because sometimes it helps with the search. But at the end of the day, Dr. Jansen can assess whether what the AI is saying is true or not, or makes sense or not. So you can always verify AI answers when it's your profession, because you have the foundational knowledge. When you ask AI about things that it's not your expertise, it's best to actually still check with an expert, especially if your life is being concerned. Yeah, correct. Jen?
Next question from Miss Danny. Can a breast lump cause a blighted ovum? If I have the lump removed, can I still conceive successfully?
Those two are not related to each other. Those two are not related. So blighted ovum is when the ovum gets fertilized by a sperm that is defective. Blighted ovum. So in other words, it's a zygote, not even an embryo. It's a zygote that failed to form because the sperm that fertilized it was defective. Yeah, so that's a blighted ovum. It has nothing to do with your hormones. It has nothing to do with the breast lump. So whatever happens in the breast lump, you can still conceive and try again. Okay,
Hallelujah.
so patients who had or who have history of blighted ovum, they can conceive successfully in succeeding tries.
Yeah.
And the succeeding tries can be 100% normal or 100% successful. Yeah. So
it's
yeah,
just
try
it's
again.
just like you had sorry to say this, but like a bad egg or a bad sperm, right? It doesn't mean all your sperm is bad. It doesn't mean all your eggs are bad. It's just that particular one, and it doesn't affect the next one. Doc, I have a real question to ask, right? A patient who has been diagnosed with cancer, should they try to conceive?
It's okay. It's okay.
Okay.
As long as the patient is already in remission, because the treatment for cancers can be very tricky. So if a patient is pregnant and the patient was diagnosed with cancer, the doctors are quite apprehensive of giving treatment
Chemo,
because it might affect the baby.
Baby, right?
So,
yeah, definitely.
So usually, there should be an agreement wherein the mother should give birth first. Take the pregnancy to term, then give birth, then we go in and treat. So usually that's the case. Even in integrative oncology, we tend to not give treatment to the patient, especially if the patient is pregnant, because a lot of the protocols that we use are we don't know if they are okay with pregnant women.
Because some of the protocols may provide some stress on the body, right? In one way or another.
And they were not studied.
Yeah, well. Not studied.
If it was not studied, then I mean, it might do harm.
Correct.
So then when you give birth, that's the time that we go in. Or perhaps to strike a balance in between, because time is
Uh,
since perhaps carry the pregnancy be delivered preterm, but sufficient enough that the baby would be able to survive normally, yeah, without sacrificing health, future or long-term health, no, of the baby. Then yeah.
So, for cancer patients who are pregnant, the only things that we can safely do are things that were safe for pregnant ladies in the first place, right? So that means taking things like curcumin is okay, right? Galangal, I mean ginger, I mean eating healthy. These are the okay things that we can do when we support cancer patients. Then they can do this as a way to manage their cancer while they are pregnant and waiting for the baby to be delivered. Right. So you would still like prescribe lifestyle protocols for a pregnant cancer patient?
Yeah, lifestyle protocols can still be done. No? At least that's something that you
It's
can
safe.
do.
Yeah, you can do
Yeah,
because
it's
we would do
safer.
it. We would do it even for a pregnant lady who doesn't have cancer. Some of these protocols are something we can do. So for those of you who are in this it's a very difficult position. You are pregnant, which means you are so happy and excited about having a baby. But at the same time, you are fighting this life-threatening illness, cancer, right? So, and I'm sure for the father, it's such a nightmare because one is his wife and the other one is his kid. So I just want to share one thing that you can do, especially if we always do suggest in the second trimester onwards. PPARS is actually very, very good for pregnant lady second trimester onwards, right? So if it's good for pregnant ladies, then if you have cancer and you're pregnant, then it's really good. But take it after the first trimester, because the first trimester is the time where it's the trickiest. The only people that for me personally, we encourage to take PPARS are people who can't conceive, right? There are people who have tried very long and they cannot conceive. Then we tell them to take it right from the beginning when you're trying to conceive all the way. But those who do conceive, are able to conceive and already are pregnant, we usually advise after the first trimester. The reason is the first trimester is always the most sensitive time for people. And nowadays, right, first trimester is very sensitive, right? It's the stage that most parents needs to cross. And during this stage, we just want to keep everything status quo, no change at all. But after the second trimester onward, you can really want to nourish the kid and help the growth of the fetus. And that's when the supplementations then become important, and it's good to do that. All right, yeah.
Okay, moving on to the question. Okay, from our Facebook, from Sir Jose. This is my 4th month on PPARS powder, but my PSA went high, FBS is high, borderline CREA. Also, since I started taking PPARS, I'm always constipated.
Oh, first of all, drink more water. That's my first thing, right? When your body is spiked. Did he say what is his condition? Why is he on PPARS?
Well, PSA is high.
Yeah, but there could be a lot of reasons why his PSA is high. So yeah, maybe I would hope that you can clarify what's your original condition and why you're taking PPARS. Right. I mean, prostate cancer is the thing that comes to mind. Yeah.
Also remember, you're taking powder, so you should not be swallowing this. So PPARS powder does not have any effect on your gut or your bowel movement, whether you become constipated or diarrhea or with diarrhea. FBS is high, probably, so you're diabetic. The diabetes can affect diabetic patients can have constipation. So that's for one. So PSA went high. More information has to be taken from the patient, no? So what is happening? So
yeah, I think for this patient, I think have a consult because number one, it's very strange that your FPS is actually high. Because anybody who takes Simply Nature PPAR powder, you will see your blood sugar normalize. Just taking tablets and soft gel capsules is alone is enough to do that. And you're taking the powder extract. So that's really just very unusual. Have a proper consult so that there is a proper asking of questions by Dr. Jansen so that he can understand your condition more specifically instead of you just typing because you might miss out something. All right, but I think Doc, would you say that it's enough reason for him to want to have a consult?
Yeah, of course. This is a
unusual,
unusual,
it's a puzzling thing. It's like
you're spending.
Yeah, and it's like taking high blood pressure medicine and your blood pressure go up. It's not supposed to be like that. Yeah.
Yeah. The root cause has to be investigated. What is happening? Why is it so?
Yeah.
I have to talk to you.
And again, I love this is what I hope all our listeners are listening in because many times a lot of times the listeners are also your patients. They're trying to get a free consult. No, I'm joking. No, we love you guys and this is why we do it, right? Because we understand that even for like Doc Jansen's patients, right? After you go home and you're doing your protocols, after your treatments, there might still be how shall we say developments that are surprising, for example. And usually, if there isn't a program like that, some people just ignore it until it gets more serious. So this is another reason why we do this program. You don't have to ignore things. You can actually, every Thursday, right, come on our program and then ask us. And then we'll tell you, hey, that's very unusual. Please come for a consult. So then you don't ignore. You actually ask and then you're like, okay, yeah, I really have to go for a consult so that we can see what's happening. And as Dr. Jansen said, you bought an extract powder. Get the best value out of it. Don't just keep eating every day and not knowing what's happening, right? So we love to do this program because we love to respond and follow and walk this journey with our patients and our clients. Yeah.
There's been a feedback already actually. So it's a prostate enlargement.
And
enlargement. After the first jar, it already lowered na. But this latest laboratory result went high again.
So it went down, it improved, and then it went back up. So I think you really need to be interviewed because Dr. Jansen or his HCS will ask you the medical history clearly to identify in the middle what happened. All right. So please go for a consult.
Okay, next question from Facebook. I am blessed. Can PPARS help delay the aging diseases or degenerative diseases like osteoporosis, arthritis, ACL, or knee issues, and the like?
Okay, we don't have evidence for that. By evidence, I mean research studies, clinical evidence that shows that it indeed delays. But in theory, it should help patients with those kinds of conditions because Simply Nature PPARS has a very strong antioxidant property. So, but I won't use it as a standalone or a monotherapy protocol. So I would use it together with the other things or other medications and supplements that is already effective, that is known to be effective.
I just want to add also the list of diseases that you listed out, right? PPARS work on one or more of their root factors, right? So we're not talking about the disease itself, but what gives rise to the disease, right? So as Dr. Jansen said, managing inflammation is really important. PPAR actually preserves mitochondrial functions. So I've been taking PPARS for a long time, right? Since 27 years old. I'm 51 years old this year. So, it always had an anti-aging effect, but we have been, our initial research like 10 years ago was that it's very good for metabolic syndromes, right? Maintains your blood sugar, blood cholesterol. So we can't really understand how that has a anti-aging effect. We understand the inflammation part, but that's not really directly, what people want to hear about. Oh, looking young and things like that, and the energy level as well. Even though we can understand how inflammation will make you feel fatigue and things like that. So there are many factors that go into this thing called aging, and there are many factors that go into the thing called fatigue. So today we understand a bit more. So not only is it because of the inflammation, PPAR actually preserves mitochondrial functions, right? So that will also be another reason why when you take PPAR tablets, because you're not sick, right, that you also feel energetic, right? So as we go and we understand the product more, we actually understand more reasons why we see the results that we do. So yeah, I hope that is useful. Yeah, so yes, please take the tablets. It's the best thing. If you don't know what supplements to take and you're generally okay, you think that you're healthy, then I think there's nothing better than PPAR tablets. Why? Because our modern day lifestyle, even if you're healthy today, the greatest threat to your lifestyle is probably high blood cholesterol, high blood sugar, hypertension, right? So these are the standard things that come with our modern day lifestyle. So PPARS addresses these things directly and its root causes directly. So it's wonderful to take a supplement that actually protects or helps you manage the most common thing that our lifestyle produces. Yeah.
Okay, before we move on to our next question, let me just give a quick shout out to our viewers, Miss Helen Camunayan, Marmin Andrada, Miss Janet Ku, and Nomi Veras from Bicol, and Mini Gamab Concepcion. Thank you po. Okay. Next question from Lazada, actually, sir. What is the difference of green stripe versus purple stripe? I think it's referring to the tablets.
No. Okay. This one I answered now, Doc. Okay, the purple one has red grape skin polyphenols. All right. So what we do is that the green one is the pure original microalgae. Right. The purple stripe one is with grape polyphenols. So what are grape polyphenols? These are actually the best parts of the red grape skin. It's what makes wine beneficial for health. The French always tell you drinking red wine is good for you, good for your heart and things like that. So the thing that makes red wine good or healthy is the polyphenols found in red grape skin. So green or white wine is different from red wine. So it is the red wine that has the health benefits and not the white wine actually. So okay, so we added the polyphenols into it. Now, out of the polyphenols, one of the more famous polyphenols found in our tablets is called the resveratrol, right? We've all heard about that. There are actually supplements that are pure resveratrol. Okay, we added this because the two actually do work together. And yeah, that's why for our doctors, they often prescribe polyphenols, the blue or purple stripe one. But there is actually a particular condition where people don't want to take resveratrol, right? GSPT, what's that?
G6PD.
Yeah, right. That's the one condition that you should take the green one. It's better. And there are people who are actually allergic to, for example, red wine. Right. So yeah, that's it. Which one is better? I wouldn't say either is better. They're both great. Right. I alternate. For me, I alternate. Right. The one order once I finish the green one, I go and take the blue one. Once I finish the bottle of the blue one, I go back to the green one. So I do a little bit of alternation on my side. Yeah.
Okay. We're almost at the end of tonight's session, so we are last 3 questions for
All
the
right.
evening.
Yay, I'm tired.
Okay, from Luis. Can PPARS help improve or manage platelet count? Apart from PPARS and blood transfusion, what else can you recommend?
Doc, I want to ask you this. I have to, maybe later I'll do some research. For dengue fever, the platelet count drops, right?
Yes.
Yeah, so my Minang son, the platelet dropped until single digit. And then she rushed the pipa powder to the hospital to him, gave it to him, And like 4 to 6 hours later, actually, if I remember correctly, it was 4 hours. It actually almost went all the way back to normal. So what is the possible mechanism?
Yeah, so you have to know why the platelet count is low
Dengue. That
first.
one is dengue. Yeah, that one is dengue.
Yeah. For dengue is a viral infection.
Okay.
So the PPARS is actually acting on the virus and the immune system.
Oh.
So you're seeing the symptom get reversed. So the low platelet is a symptom of the dengue fever. You have to know the mechanism behind it first.
Okay.
Yeah. For you to know if it will work or not.
Okay.
Yeah, because it doesn't always work. So one example would be for chemotherapy patients wherein the bone marrow has been destroyed.
Yeah. No matter what you do, right?
No matter what you do, it won't work. No matter what you do. The only solution for that is for you to get a bone marrow transplant or you inject stem cells, hoping that the stem cells will become new bone marrow and generate more blood cells. So if that's the case, then nothing will work. Those are the only things that will work. Yeah. Okay, so you have to understand the mechanism first. So the question, the information is not enough. Yeah, but for viral infections, for example, even HIV, you have an HIV patient.
Yes, the HIV patient, everything, wonderful.
So HIV is also a viral infection. Same thing with influenza, with dengue fever. And when you give simplynature PPARS, it acts on the immune system and the virus.
Wow.
That's why the symptoms get reverses. Okay, so you have to understand the mechanism first.
So in general, for inflammation, infections, and metabolic stress, it's a good bet that PPARS will work. For other reasons, like for example, your bone marrows are totally destroyed, then not. All right.
Yeah.
Jen?
Yeah.
Okay, second to the last question from Sir Ronald.
Interesting
Can PPARS
question.
help with sperm count?
Whoa, this is interesting.
Interesting. Sperm count.
What helps with sperm count, or what affects sperm count? No, this is while Doc is thinking, let me just say this is a very important question, and for the person that asked this, I just want to say that this problem is a very common problem today. All right, that's why fertility rates are so low. Not only is the sperm count important, the modern men not only have a low sperm count, we have low motility. That means your sperm doesn't swims too slow, doesn't make it upstream, right? And also a lot of weird heads. That means your sperm heads are weird, which also affects the ability to fertilize, right? So all these reasons, so for guys, if ever the doctor tells you you have low sperm count, low motility, number one, don't feel so bad. You're not abnormal. A lot of people are like that. You're not lonely. You're not like so shame. Why am I the only one? No. It's actually a very, very common issue right now. So I think it's really our lifestyle. And so number one, don't feel bad about it. Now let's ask Dr. Jansen if this can help at all.
Okay, there's a lot of factors which can affect semen or sperm, no? Now, you have to understand first what is wrong before you can say if a product will work or not. Now, PPARS can help. That one, I will say an absolute yes.
Wow.
But again, not all patients will respond because again, you have to understand first what is wrong. Okay, so for semen, well, you have your liquefaction time. Liquefaction time is the amount of time or how long semen turns to liquid.
Oh,
that's
okay.
one. Yes. Wow. So if it's too long, then it's either you're dehydrated, semen is too thick. So you would just have you only need to give
More
patient,
water.
right? And that's it. Water, more water. Yeah. So those are, yeah. So that's one solution. There are also situations wherein you have inflammation. So what causes the inflammation? You can have infection. You can have inflammation of the epididymis or epididymitis. So why is the epididymis inflamed? One might be because of the underwear you're wearing. Number two, sports or physical activity can also impact that, especially if you're someone who is an athlete and you are moving rigorously. You get my point. So you have to wear proper underwear or supporters, no, for that matter. Another thing is if the scrotum is always warm, or the scrotum is always warm. So again, that would depend on the underwear, the type of underwear you're wearing. If it's too tight, then the scrotum would be too near your body, and the scrotum would be too warm, so that can affect sperm count, because sperm can live only, it lives below the core body temperature. If it goes up to the core body temperature, they die. Yeah, so that can affect sperm count as well. For PPARS, so let's talk PPARS. Metabolic syndrome can affect fertility because of chronic low-grade inflammation. If you have diabetes, it can also affect fertility. So the diabetes can affect the mitochondria of the sperm. So it can have low motility. So that's what Shyan is saying. That's what you're saying, no?
Yeah.
Another thing is lack of sleep can as well. So too much stress, for example. So those things can affect sperm quality. Another thing is if you are exposed to forever chemicals, hormone hormone disruptors.
Wow.
Was it disruptors? I forgot the proper term. Was it disruptors? So so those things, if you're exposed to, so that can affect sperm quality and fertility. Yeah, for men.
So, Doc, I saw this one very interesting because here it actually proves the mechanism that actually can improve sperm production. It's because it's a drug test. They did it on pioglitazones, right, which is a PPAR gamma agonist. It improves Sertoli cell energy, and they especially for diabetic models, right, clinical models. So improve semen parameters and testosterone. So here it just is a mechanistic proof because this is a drug test and not a nutrition test. So there you go. That there is at least one understood mechanism for your development of your sperm. So PPAR gamma in our product is a natural form. So the mechanism is the same. Whether it's pioglitazone, which is a synthetic ligand, or it's natural, like in ours. However, Dr. Jansen made it very clear. There are so many other reasons also. So here it is, right? You want to improve your sperm count, it's different categories. Temperature, you must make sure your temperature is correct, wear the right underwear, everything. Then when it comes to nutrition, make sure it's correct, like in your supplementation. What supplementations can help? So yes, PPAR is one of them. But then you can't just do the supplementation and then don't do the rest, right? It's still not going to address your sperm count issue. So for the sperm count issue, it's holistic. So so it's split into a few categories. Make sure in each category you are doing the right thing. Then I think you have a better chance of working out a better strategy of improving your sperm count. Yeah.
Okay.
And I just want to say today's fertility rate, because there are many people around me that have this fertility issue, and I don't know, Dr. Jansen, as a clinical practitioner, right? Yeah, whether you find this to be the case also. There are many couples who actually manage to conceive, but finding it very difficult to cross the first trimester, right? and a lot of it has got to do with. I sometimes I joke about it because it's a hostile womb. A lot of times it's actually the immune system of the mother attacking the embryo. All right. Yeah. And I make some. I shouldn't even joke about it. So let's not go there. Yeah. So it seems that very commonly it's like that. They are able to conceive, but not past the first trimester. Do you find that that's also something that doctors have noticed or discussed? Not Jansen. Or not
Not
so
so
much.
much because I'm not in that field,
You're not
so
in
I
that
don't
field.
get to hear
Okay.
these things.
I am because I've tried twice. I mean we've tried, you know, so we've actually I mean now we can speak about it because I think time has passed, you know, sufficiently. So we've had 2 miscarriages, and both is because the immune system actually attacked the embryo, so they never passed the first trimester. So and then when we chat with our friends who are also trying and having this same challenge, it's the same. It's the same thing. One thing is interesting is, of course, when you talk to your friends, you will notice that they are your friends, just like family. They eat the same thing and probably have a very similar lifestyle to us. So my wife and I work a lot. We were under a lot of stress. So these are just some factors. So some people that I have heard that had trouble conceiving and then finally actually made it, and I'm not talking about IVF, is that they actually took 3 to 6 months off work. Literally didn't work, and if you don't work for 2 weeks, it's not long enough for you for your stress level to go down, right? For your body to actually get back in sync, and then your sperm production is actually healthy, and your womb environment, everything becomes normal. So I've actually had friends who were successful to conceive when they actually took a 6-month break from work completely, you know, and then they were totally relaxed and they actually conceived. So I'm just sharing this is a topic that there are so many factors. There are people who spend a lot of money and they still can't conceive. There are people who took a break and then after that they have their child. So just sharing out there in case you've tried one, you could try the other as well, right? Because this could be something that's really important to everybody who wants a child. Yeah. So okay, I did not try the 6 months don't do anything one. Okay, so and now at age 51, yeah, we just love our niece and nephews a lot. Yeah. And you know, I love my godsons a lot. And be a pain in their life instead. Hallelujah. Yeah.
Okay, interesting turn of topic. Our last question is from Miss Jana. Which one is more effective for dysmenorrhea? PPARS tablets or cleansing plus?
Cleansing plus won't do anything, so I will go for the tablets if I'm going to choose only between those two.
Okay. So we're done. We can take a break. Oh my God, it's 1 hour.
It looks like we've covered all our questions. So as we wrap up this evening, we'd love to hear your final thoughts for our viewers.
Go, Doc.
Okay, I'll go first. So again, I want to thank all of you, for attending and listening and asking those questions. Those questions are again quite new to us. We've been doing this for 3 years. 3 years now or 4?
4. I think 4.
4 years. Oh my goodness, it's 4 years.
And we're so faithful in it. I mean, we have only skipped, I think, less than 5 in the 4 years, 5 weeks. I think, wow. This is the most consistent thing I've done in my life.
Same here. So thank you guys. Thank you everyone for staying tuned, for supporting this program of ours. Without you guys, we won't be able to reach so much or give value and reach so many of you. Now, please continue sharing and commenting. Most importantly, sharing this program. If there's anybody who you think might need help, then go ahead and share this program. Ask the person to ask their questions, and we would answer those questions as much as we can. But again, this is for educational purposes only. It doesn't constitute a consult. Okay, for you to have a proper advice, please schedule your appointments. Okay, so that's it. Um, Happy Halloween. Thank
Oh,
you,
yes.
everyone. Yeah, give the floor back to Shen. Bye,
Alright.
guys. Bye, guys. Good
Alright.
night.
Good night, Doc. Well, I just want to reiterate what Doc just said. And of course, our conversations have always been very enjoyable and we learn. You can actually see we actually do enjoy doing this program. Except sometimes when we are very tired because, we're doing this program after a whole full day. It's not like we are DJ and we rest during the day and then do this program at night. We actually have a full working day, but we are always very happy. And as you can see, I think Dr. Jansen and I also enjoy our exchanges. I ask him questions. When he's answering, I ask questions on your behalf because the topics are interesting. Now, if I want to encourage you guys, because we have an SMX in 2 weeks, right? At SM Aura in BGC, Bonifacio Global City. All right, we actually have an SMX where we will be live. So the way me and Doc Jansen interact, you can see tonight, he says something, I ask a question immediately because in response to what he says, you can actually do that live with us, right? In a room, maybe we're just aiming for like 30, 40 people so that we can have an intimate discussion. Yeah, so do come. If you have questions about cancer, about your health, about how to mix conventional medicine that that you get from the hospital and integrative natural, right? Then this is the perfect time. You can and we also invited Dr. Joy. She will have a segment of Q&A, but hers is totally about natural, right? So you'll hear about the natural, and then you hear definitely Dr. Jansen, who is not just natural, he's also conventional. So his is really integrative medicine, right? So I think that day will be a wonderful day for you to interact. So mark it down on your calendar. It's November 15, or November 15, Saturday. All right. It's done at BGC SMX Aura. So it's at one of the nicest SMs in the country. And right beside that, there's another super big mall called Market, right, by Alaya Malls. So it's actually a wonderful place to go. Come with your family, because normally when we talk about cancer questions, right, you might want to bring your husband or your wife, or sometimes your kids are very interested because they don't trust you. They want to know for themselves. And then they can also come and help and listen. And so tickets are limited. Please make your order. And then me and Dr. Jansen would love to meet you, especially those of you who have watched our program for a long time. Please come on that day and tell us, hey, I've been watching Simply Healed for 3 years, and I'll be able to give you that warm handshake. Finally, we meet in person. All right. So once again, have a great weekend. We'll see you next week. I'll hand the time back to Jen.
Thank you so much to our experts, Dr. Jansen Calalan and Mr. Shyan Lim, for sharing their knowledge and insights. If you have any follow-up questions, don't worry, we will answer each of them next webinar via direct message. And we hope to see you again next week for another empowering session, same day, same time, every Thursday night at 7:30 p.m. It's almost November, guys, but there's still time to prioritize your health and your family's well-being. Experience the proven benefits of PPARS at an unbeatable price and take control of your wellness journey today. You can now buy your PPARS liquid extract or PPARS powder extract with no shipping fees. So whether you are ordering from Metro Manila or anywhere nationwide, you can avail this free shipping promo, only available via our official website at www.simplynature-inc. And present the ultimate gift of health this Christmas for your loved ones with our Power Pack 5-Day Immunity Booster gift package or Kickstart 15-Day gift package, both 100% natural to support and strengthen immunity. So don't miss our early Christmas promos. Buy 8 but get 1 extra package for free. And lastly, don't forget to bring them face-to-face in our health conference, as what Session said, is entitled Defying Cancer Diagnosis, Thriving with Science and Nutrition, next month on November 15, that's a Saturday at SMS Convention Center, SM Aura BGC Taguig. Let's all watch this.
Hi, I'm Shen, PPARS expert from Singapore.
If cancer is an important topic to you, your family, or a loved one, and you have lots of questions about cancer diagnosis, treatment options, or even how to prevent cancer recurrence, then we have the perfect solution for you. Mark this down on your calendar. November 15th, Saturday. Join me and Dr. Jansen Calalan, one of the leading experts in integrative cancer treatment, as we host the Define Cancer Diagnosis Conference. From 8 a.m. to 12 noon, we will be exploring how PPARS, peroxisome proliferated activator receptors, can be a success factor in your fight against cancer. We will also be looking at successful cancer cases, and of course, the most exciting segment of our program, which is the live questions and answers segment, where Dr. Jansen and I will be sitting as a panelist to answer all your questions as honestly as we can. So if you have questions on whether you need surgery, when to do, what type of scans, how do you blend conventional oncological protocols and natural support or even natural treatments, this is the place for you. Ask your questions as we explore the answers interactively and honestly together. So tickets and seats are limited, so please register with the link below. Dr. Jansen and I and our entire team will be looking forward to supporting you and answering your questions on November 15, SMX, Aura, BGC, Taguig City. See you there.
So join us for a transformative morning as we dive into cutting-edge insights on medical nutrition, oncology, and syempre, di mawawala ang PPARS and cancer treatment. And thank you once again for watching Simply Nature webinar powered by SMG or Simply Healed Medical Group, because your curiosity and victory about your health condition is what fuels our mission. Here in Simply Nature, we are always with you from start to healing.